What is the next popular
Yeah.
kind of request that calls
So,
you?
body work, tummies.
Body work. Tummies. Okay,
Tummies.
tummies. So what are their concerns about their tummies?
Either they have laxity of skin or there's fullness. Usually it's laxity of skin if they're on a
Hmm.
weight loss journey or had
Okay.
kids.
Okay.
And just, they want to wear a bathing suit or even clothes. Again, it's the clothes. You can fit
Right.
into your clothes comfortably
Right.
without having to hide or wear Spanx.
Right. It's we're Spanx. Okay. So it was interesting you made the comment
Mm,
about the pain for women, and you were talking about physical pain
right.
with breasts that are drooping. Okay. Of course, heavy ones we would understand that, but even non-heavy ones cause
Hmm.
patients discomfort.
Right.
I absolutely see that for women who have such looseness of their lower abdominal skin. Occasionally you get men, but it's mostly women. And it's related to babies, being
Right.
pregnant, okay, sometimes weight loss journeys. But the skin on the abdomen hanging down so low, hanging
Hmm.
down, onto their thighs. We've seen that. We see that it's difficult for them to wear clothes, to wear
Hmm.
underwear,
Right.
wear their jeans and so forth, and
Workout
so
clothes.
workout clothes, and so
Hmm.
it's really really bothersome. And then they find that they wear clothes that is even more billowy or big, which
Mm.
makes them look even bigger.
Hmm.
Okay,
Hmm.
so we're talking about tummy tucks, right?
Yes, tummy
Okay,
tucks.
all right, tummy tucks. And believe it or not, we can do most patients' tummy tucks under
Hmm.
local anesthesia. That's the only way I do surgery. And you don't have to worry if you were to come in and if I didn't think that you were the appropriate candidate, I would refer you to one of my colleagues who only does operations
Right.
under general anesthesia. Again, we're known as the local
Hmm.
anesthesia office, right? So, doing tummy tucks. And so, what technically do we usually do after we infiltrate that area, inject a lot of local anesthesia in the area? What kind of are the main steps, would you
Yeah.
say, of doing a tummy
Yeah.
tuck?
So definitely liposuction is involved to help,
Okay,
minimize some of
right.
fat if there is some there.
Okay, so we do a lipo-abdominoplasty.
Hmm.
So we do combine liposuction with the tummy tuck.
Hmm.
Okay, what else do we do?
And then, if the patient wants, we can add extra areas of lipo, so we can contour their waist, make them look better.
That's a great point. So sometimes patients will come in and just they're concerned about the front of their abdomen,
Hmm.
and I'll turn them to their side and have them look in our three-way mirror at their backside and show them that muffin top,
Yes.
that area that we'll call the flanks, technically behind us. If we can contour that, that makes a huge
Hmm.
difference in their self-image and how they fit into their clothes.
Yeah.
And in
Yes.
fact, I would prefer to do lipo of the flank muffin top
Mm.
area over the abdomen in terms of benefit ratio for the patient.
Hmm.
Okay, so we do lipo, we contour the body, and then what do we do?
And then we create, well, sometimes we can create a new belly button.
Okay,
Yeah, for the
all right,
patient.
okay, so
And then the tuck portion, so removal of the excess skin for
okay.
them.
So what we do when we do that, and we would go over this in a
Mhm.
consultation, and all you have to do is speak with Karina in our office. But what we would do is we would remove skin from
Mhm.
what we call the pubic bone, so where your pelvis is, up to around where the belly button is. We
Right.
remove that skin, and then we take the upper loose skin and we bring it down and we close it up, and then we make a little hole and we pop the belly button out through the
Mhm.
hole like a button, right?
Yes.
And that's and a button in a shirt. So we will do that for the patients. There is a small number of patients who can get just a mini
Mhm.
tuck or a
Mhm.
bikini tuck where the skin from the belly button up to their rib cage is okay, but it's just a lower kind of panniculus or hanging of
Mhm.
skin on
Mhm.
the lower part of the abdomen. We just had a young lady that came in, and
Yes.
we have her scheduled for surgery where we can just remove that area
Mhm.
for them. And so that's a bikini tuck. And
Yes.
the recovery with that, it's not as invasive and the recovery is quicker.
Mhm.
And usually we can keep the incision even a little bit
Mhm.
lower. Okay, so that's what a tummy tuck entails. Now, recovery is a little bit longer
Right.
than with a breast lift or a breast augmentation, but usually I will say that most people can drive after about a week and a half.
Mhm.
Okay, if they're comfortable. Most people are back to work, I'd say, in maybe about 2 weeks'
Mhm.
time, and then we allow them to start maybe doing aerobics or cardio, if you will, maybe 3 weeks, and
Mhm.
then we have them doing maybe more strenuous exercise, weight training at about a month. Okay,
Mhm.
is
Mhm.
kind of what we usually recommend for their post-op
Right.
course. Um, Karina, without well, actually, I asked you if it was okay. So let's talk about you're a mommy, right?
Oh yeah.
Okay, okay, you're a mommy, and you're so young and wonderful, intelligent and beautiful, and all that kind of all those good things. But you have talked to us about the possibility of a tummy
Oh yeah, that's on my Christmas wish
That's
list.
on your Christmas wish list. Okay. So without going into great detail, but tell me, I look at you and think, you look great,
Right.
and you're not, maybe at the beach you're showing off your belly button,
Yeah,
but not here at the
yeah.
office. You're not showing off your belly
No.
button, and so what is it that's the motivating aspect for you? Because I know somewhere down the road we're doing this for you, right?
So, for myself personally, I can
Yes.
put myself in the patient's shoes. Is I work out, right?
Right.
I love Pilates. I love to work
Hmm.
out. And there's just that one area where when I work out, I see looseness of skin, and
Right.
it's annoying.
Right. It's annoying.
It's annoying. So,
It's annoying.
I dress well. I hide it
Okay.
very well.
Okay.
But I know it's there. So
Right.
for me, I can share that experience with the patient where you feel good. You can feel great about your body,
Right.
and there's one area where you're like, I don't really like that.
Yeah, you don't like that. And if there's something you can do and do it
Right.
safely and reasonably priced, then it's worth doing, right? So,
Yeah.
okay. Or if you work for a guy, you know a
If
guy,
I know a guy,
you know a guy, then we can do it for you.
I've thrown it out there. We should have staff lipo day. Line them up.
Okay. Oh, gosh, this is going to cost me money, I can tell. Okay. So, I'm listening to you and I'm listening to what your pains are,
Right.
and that's clothing.
Mhm.
And I also heard you made a comment about exercise. So you exercise a lot. And I know that as much as I try to take the staff out and have staff meetings and dinners, you sometimes are forced to eat because that's sort of a Chinese thing that old people do. Old Chinese people are like, oh yeah, come on, eat more, and I'm just like my mom and my grandmother. So, having said that, you said almost in a guilty fashion. I hear this from patients all the time. I work out, and and I have this loose skin here,
Yeah.
or God, I guess I just need to work out more.
Mhm.
And they think that working out more is going to make that loose skin be better. Okay. And I will tell you, it's not. So
Right.
quit feeling guilty about it. Okay. There's just, in fact, if you work out and you lose weight, that
Mhm.
skin's even going to be
Yes.
more loose. Okay.
Yeah.
So it's not something that you want to work out to be healthy. You want to be at a healthy weight. You have a healthy lifestyle, but it's one of those things where you can't affect that looseness of
Right.
skin without our help.
Right.
Okay. So if somebody's interested in any of these things,
Mhm.
if somebody's interested in breast augmentation, breast lift, which are the top two, and then finally possibly a tummy tuck and kind of have conversation with you, we have about 30 seconds. Tell me, what should they do,
They
Karina?
should just call us. That's
Okay.
the best. Call
Okay.
us, talk to me.
Okay.
And then again, the winter and
Right.
spring are great times to do these things because then you look great for summer and
You-
the other things.
that's totally true. I'm seeing that our surgical schedule is now
Mhm.
booked out several months, and
Yeah.
patients are not happy because they think about it for 5 years and then they want to have it done yesterday,
Yes,
right?
yes.
So if you're thinking about it, our consultations are complimentary. Give us a call. Talk to Karina. She'll be your first point of contact. Usually we have you send in some photos, and then you come in for a personal consultation with us, and we spend about an hour with you. So, Karina, thank you for
Thank
being here.
you.
It was great to have you
Yes.
back. Thank you so much.
Thank you.
And I thank Jeff, our program director, and I want to thank everybody out there, Sonoma County, Napa County, and Maui.